Welcome to another episode of Wild and Well. Today I'm speaking with Naturopathic Doctor, Dr. Madeleine Elton, all about postpartum anxiety. Welcome, Dr. Madeleine. But before we get into the podcast, can you tell us something that you did for yourself today? Something that you did to nourish you?
Oh, that's a good question. Well, I took my dog for a walk, and I always find like getting out into nature and having just some quiet walking time in the morning is always a nice way to start the day.
That's a beautiful way to start the day. I think the world would be a much different place if we all started in that way.
Yes, yes, absolutely.
So, can you share a little bit about you and what it is that you do as a naturopathic doctor?
Yeah, absolutely. So, as you mentioned, my name's Dr. Madeleine Elton. I'm a naturopathic doctor, but I always say to all my clients, like, please just call me Madeleine. That's a-okay with me. And I practice in Hamilton, Ontario. I originally trained as a registered nurse, so I've been a nurse since 2011. And then I graduated naturopathic medical school in 2017. So I've been working in the healthcare space in different forms for about 15 years. I currently practice out of two different clinic locations locally, but I'm able to service anyone in the province of Ontario. And although I see a little bit of everything, a lot of my clinical focus is on mental health and hormonal health.
Those are two really big areas, and I imagine lots of mothers and women are really needing that support.
Yeah, absolutely. Mhm.
So, how did you get into working in that area, mental health and hormones, and even more specifically, postpartum anxiety?
Yeah, I was so excited to talk to you today about postpartum anxiety. I think part of the reason it is an area of interest for me is like so many people, I think when you go through something personally, you want to help others when they are experiencing a similar struggle. So I've dealt with anxiety on and off for I think probably a lot of my life, although I didn't have the language for it probably until my 20s. It wasn't something that was as commonly talked about when we were young, unfortunately, but I'm glad that that's changed so much. And particularly for postpartum anxiety, it was something that did impact me after I had my first child. So I have two kids. They are now 3 and 6. So I'm out of the trenches of the postpartum world, but I still remember it like it was yesterday. So yeah, I'd be happy to tell you a little bit more about my personal experience as well, if you'd like.
Yeah, I'd love to hear it. I think a lot of the time, our own experiences personally really inform our professional work. I know for me, it's very similar. I didn't know I was going to struggle so much postpartum, and then I did, and that really shifted the focus of my work. So I would absolutely love to hear about your experience.
Yeah, okay, for sure. So it's funny because in a lot of ways, I actually did expect to struggle postpartum simply because I know from my education that people who have struggled with mood disorders are at a much higher likelihood of experiencing postpartum depression, anxiety, whatever the case may be. Of course, it's not a guarantee by any means, but I knew the risk was higher. So a part of me was sort of expecting it in some capacity. But of course, even for people who are experienced and trained and are even potentially waiting for it, it came in a way that I couldn't have even anticipated. So my daughter was when I was giving birth to her, we had started at a birthing center. And when I was about, I think, 9 centimeters dilated, unfortunately, we had to transfer to the hospital. So it had started off pretty calm, as I think a lot of births do, and then it just sort of turned to chaos. I had to actually get into my husband's truck and drive to the hospital in like full active labor. It was really intense. And then ultimately at the hospital, she had to be vacuumed out, and I wasn't able to actually see her or touch her or anything for probably, it wasn't all, in hindsight, it wasn't a long period of time, but it was probably maybe 6 to 12 hours. So in the moment, being a first-time mom, experiencing all of this for the very first time, it was quite traumatic for me. I didn't know what she looked like. I didn't know what color hair she had. I didn't know what color eyes she had. And all I wanted to do was see my baby. So I think that sort of triggered a lot of things for me, plus the mix with all of the hormonal shifts that are happening and potentially, my history of anxiety and that kind of thing. It was a perfect storm. And really, it was within that very first week postpartum that I was already experiencing pretty extreme shifts in my mood, and everything from not being able to sleep, losing my appetite, having new fears that I'd never had before. Like I was feeling scared of dusk. Like as dusk would approach, my fear would bubble up. All of these things that I had not experienced, and my family and my midwives were quite concerned. So I had to, seek support through my therapist and my healthcare team. But all that to say, it was something I had never expected. I thought, okay, maybe after a few months or sometime in the first year, I'll struggle. I didn't expect it to be so immediate. And luckily, because I was able to get supports quite quickly, I would say within a few months, I felt quite good. And then for the rest of that, first year postpartum, I was fine. So you kind of just you never know how it may or may not affect you.
Yeah, absolutely. And I think your story highlights the importance of being aware of this because you had an idea, okay, I might struggle postpartum. It might not be in that first week like it happened, but having that awareness to look out for it, I think is really important. And then also to have a great support team in place is so essential because I imagine if you didn't have that, it probably wouldn't have shaped up the way it did, right?
Exactly. And unfortunately, you do hear really sad stories of it going in a completely different direction for people who don't have those support systems. So I completely agree with you. And when I was pregnant for the second time, of course, now I'm like totally ready. I'm expecting it, and I've got a whole team like waiting and ready. And then I was fine. So you just never know. But I think that's the exact point is even if you don't suspect that something may come up for you postpartum in terms of mood, it's not a bad idea to just have some resources ready that you can call upon if you need them.
Yeah, absolutely. So, what are some of the common signs that moms who are feeling anxious or struggling with low mood during the postpartum time that you have and you see in your practice? What are some of those common signs that they have?
Yeah, I think that there's a lot of different things that people can experience, but the common signs that I will see, one would be feeling very overwhelmed, just a sense of completely overwhelmed, having trouble making decisions, just that, sense of this whole new world, and you're not quite sure where you're fitting into it, in beyond just the normal change that would occur in that way. And then, sort of similar to what I had experienced and what I was talking about, sometimes people will notice changes in their ability to sleep. Now, of course, we know sleep is going to be disturbed, but big changes in terms of just experiencing insomnia in ways that they hadn't before, and that kind of thing, as well as changes in appetite. So losing your appetite, or maybe eating a lot more than normal can also potentially happen depending on the particular mood thing that's going on. And another big one would be a shift in, just not being able to find enjoyment in the things that they would normally enjoy in their lives, as well as big feelings of fear and guilt. I think those are some of the common themes that I've seen.
Yeah, I definitely would second all of those. When you were talking about sleep, what sort of changes do you notice in the clients that you work with that are struggling with anxiety or low mood postpartum?
Yeah, I would say probably more so around difficulties falling asleep and difficulties staying asleep. So for some people, it's both. For some people, it's one or the other, kind of depends. But those can exist in different ways. So sometimes people will say, I fall asleep, no problem. But then, of course, yes, you're going to be waking up in the night anyway to feed the baby, or perhaps you're getting larger breaks because you're sharing it with your partner. So everyone's sort of set up that way will be different, but just perhaps waking up even aside from those, normal nighttime wakings that you would have to do, and then really struggling to actually fall back to sleep. And then it compounds. I think that's what happened for me as well. The more you're not sleeping, sometimes the harder it is to get to sleep. And we know that like sleep is so critical for our mental health. I often will tell people this anecdote of that actors will sometimes not sleep well or not have a full sleep the night before having to do a crying scene because it's just so much easier to start crying when you haven't slept. So imagine like night after night after night of not sleeping. It goes so far beyond just crying easily.
Yeah, I really struggled with sleep deprivation in the first few years of being a parent, and I just lost all my sense of humor. Like things were not funny at all. And I just like couldn't appreciate any jokes. And that was one of the effects. But I realized when I started really focusing on prioritizing my sleep, that came back and you just start realizing you have a personality again.
Yes. Yeah, it's always a miracle when you finally start sleeping again. You're like, "Oh yeah, I forgot I ever felt this good. This is great. I want to feel like this more often."
Yeah, you never take sleep for granted after having a baby.
Yes, absolutely.
So how do you start working with a mom who's dealing with anxiety or low mood? Like what does that support look like as a naturopath?
Yeah, so as a naturopath, so the first thing I would normally do, there's a lot of different standardized questionnaires that exist. So I like to implement those as a starting point so I can see objectively, have a number to attach to where someone's at in terms of their mood. So we have specific questionnaires for anxiety, we have them for depression, then we have them for the postpartum period specifically in terms of mood. And that's helpful as a clinician because then we have a base number and we can have a sense of over time as we're working together. If we redo those every, say, 3 months or so, we can get a sense of are things improving, are they not? And it can be helpful for the client as well because sometimes it's hard to recognize the ways that things are going better for yourself when you are still struggling. If it's not a complete change, if you're not right back to baseline of feeling wonderful, sometimes doing those and saying, well, actually, look at this, your score has gone up quite a bit in these domains. And sometimes people will say, oh, actually, yeah, you're right. I forgot that was so much worse a few months ago. So those are helpful. As well as a naturopathic doctor in Ontario, we do have access to blood work that we can order. So that's an important component as well. Whenever someone's struggling with mood, we want to make sure that there isn't a different condition that's occurring that can be impacting how they're feeling. So making sure, iron levels are adequate, checking their thyroid. Thyroid can have big changes postpartum, which can also impact mood. So just doing some blood work to rule out other conditions that could be impacting the mom. And then, of course, just a lot of active listening, creating a really judgment-free zone. I think that's so important because people are scared to say things like, I'm really not enjoying this, or, this is not what I expected. There's so much guilt and shame attached to that. So just a lot like giving a space where you can just say it like it is and what you're actually feeling and know that like that's okay. And going there will allow us to work through that and get to the next place. Mhm.
Yeah, there are those emotions, that guilt and that shame especially that are so hard to vocalize because there's this idea that you are a mom and that's amazing and you should feel grateful and your world is complete, and all those things can be true.
Yeah.
And you can still be having a hard time and grieving your identity and experiences before becoming a mom. There's so much there. So I
Yeah.
love that you create that space. That's so key.
Yeah, absolutely. And I agree totally with what you're saying too, in terms of the identity piece, because it's everything from not just who you are as a person, but it's now changing who you are in relation to the other people in your life too. Obviously, especially your partner, if you do have a partner in this scenario, you have to navigate this whole new dynamic together. So it's a lot to navigate all at once while you're physically healing and you're exhausted.
Yeah, there's a lot going on.
Yes.
So, nutrient depletion is a common experience postpartum. Probably a lot of moms are going into postpartum and into pregnancy already severely depleted, and nutrients also impact our mental health. You were talking about iron. Can you speak a bit more about what nutrients might be impacting our mental health and might be connected to challenges with anxiety postpartum?
Yeah, I would say iron's probably the biggest one. We can also speak kind of more generally to just nutrition and just making sure that people are eating enough food throughout the day and eating, a variety of foods. It can be challenging in those early postpartum days to just even remember to eat, to have the time to eat, especially when you're feeding so regularly. So, it's easier to potentially just grab a quick snack of, a piece of toast or something like that, which is totally fine. And there's nothing wrong with having a piece of toast, but then people, can be harder to remember to get in adequate amounts of protein. Like protein is so important for maintaining our energy levels and that kind of thing. And then also like healthy fats, having those to, again, just for our brain health and our energy levels is important. So I wouldn't say there's any kind of like one specific nutrient other than, like I said, iron is a big one, but it's probably a lot, just a bigger picture of continuing to try to eat as much as you can, like a wide variety of foods and not just quick snacks.
Yeah, it's really hard when you're a new mom to be doing that. I know for my first, I didn't prepare meals ahead of time. And for my second, I did because I learned that I needed that. And the best presents were when people brought really nutrient dense meals as well. That's
Oh
just
my gosh,
the
yeah.
best.
It's so true. I remember so with my son, my second child, we had, there's always something, again, another thing you're not expecting. We had blood type incompatibility. So he was extremely jaundiced and we had to stay in the hospital for about 5 days while he got cooked under the light. And I luckily with St. Joseph's Hospital here in Hamilton has a great setup where you can actually have a private room and stay and just kind of go for your feedings and go back and forth. It's actually quite lovely and peaceful. But, the hospital didn't have a great selection of foods. And my sister was just like, no, 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 you need to eat better than this. You just had a baby, you lost a ton of blood. And she made me a whole bunch of foods, but she had made me a big batch of bone broth for me to drink. And I don't think ever anything had ever tasted as amazing as that bone broth. Like, and my body was just, there was just a sense of like, I need this so deeply. It was so comforting and like warm, and yeah, highly recommend bone broth.
Are there other foods that you recommend that people eat, like outside of being more general with like protein and good fats, like bone broth? That's really specific. Are there other ones like that that are great for us healing our bodies as well as like supporting our minds with great nutrients postpartum?
Yeah, I think in that time when you're healing, anything that's sort of warming cooked foods is so nice. So like soups, stews. Someone had made me this really beautiful soup that had like dumplings in it, and it was dense. You don't want just a vegetable soup. You want something with real substance in it. And then for kind of quicker snacks, I also liked one thing that some people had made for me and I had prepared was energy balls because it's something you can just grab quickly and you're getting a bunch of great ingredients in it. So, there's so many different recipes out there, but having a combination of ground flax seeds, some nuts that have been like pulverized. You can add any sort of dried fruit, nut butter, that kind of thing to just like a nice dense snack. I would often pop a couple of those like before doing a breastfeeding session just to feel really satiated that way. All of those things can be nice.
Yeah, any of those things that you can eat just with one hand as
Yeah.
well.
Yes, exactly. That's already like made for you, but it's gonna be like giving you lasting energy.
And what about herbs and other sort of like tinctures and remedies? Do you use these with your clients with anxiety or mood challenges postpartum?
Yeah, absolutely. So, definitely herbs, and then there's other sort of supplements or vitamins that can be beneficial. So, of course, disclaimer being, each person has to see if this works for them, and if you're on any other medications, you always want to make sure that there's no interactions. So, before, purchasing this, making sure that it's safe for you. But some of the herbs that I really like for postpartum anxiety, a big one that I find these days actually a lot of people know about is ashwagandha. I feel like it's having a moment right now. Maybe it's like on TikTok. I think Costco started carrying it. So if it's in Costco, then you've made it. But ashwagandha actually has a great amount of evidence for anxiety. It can also be beneficial for sleep. And it's safe with breastfeeding. So that's a nice option. I also like lavender. You can buy lavender in capsule form. And I know that there's at least one, company locally that I know makes it, but I'm sure that there's several different options now. So just to clarify, like you would never want to ingest a lavender essential oil, but this is formulated in a capsule form that's safe to consume. And again, can be really great for just kind of a general sense of helping the body and the mind to calm a little bit, can be really helpful for sleep, and again, is safe with breastfeeding, as well as so many different teas can be nice, like a chamomile tea can be really soothing. And from the more depression standpoint, one herb that has quite good evidence is saffron. So again, in typically in capsule form is how that's used, and it's safe with breastfeeding as well.
Yeah, those are excellent suggestions. I know my naturopath, when I went to see her postpartum, she got me on ashwagandha and a mix of other ones. I think rhodiola, that was
Yes,
one of
rhodiola
them.
is also good. Yes, absolutely. Great combo.
Yeah, yeah, I still love those. And I have teas with them in it, or at least with ashwagandha in it and lavender. And yeah, they're just so lovely.
Yeah, and I think also for people who, we're taking, which is most people taking a prenatal vitamin, I often say, don't stop taking it in that postpartum period. It's your body's still probably depleted of nutrients, and I would say still continue taking that even over the first year of postpartum. It's good to do. Um, as well as, checking vitamin D levels to make sure those are adequate, and things like higher dose fish oil can be helpful as well. So there's lots of different things that you can take that can be helpful, and you sort of find the right combination of things that work for you.
And do you test people for the, like, do you do blood work for that? And then that's where how you determine what they need?
For vitamin D, yeah, exactly. So often, like, we'll check vitamin D, we'll check B12, we'll check iron, and then see if supplementation is needed and also how much.
Yeah, that makes sense.
Yeah.
So a lot of moms are running on empty and they're like stuck in stress mode, right? And what do you recommend that they do to help calm their nervous system? Because this is part of the work you do too, is that right?
Yeah, yeah, absolutely. It's so hard. It's so hard to do. And I feel for moms, it's like you don't want to feel like it's just one more thing now on your to-do list. Okay, like now on top of feeling frazzled, I have to figure out how to feel unfrazzled. But it is so important. It is important because that's how you're going to be able to sustain yourself and show up in the world in the way that you want to. So I think, as hard as it is to do, and of course, when your baby's like really, really itty bitty, it's even harder. But as kind of soon as you can, I would say trying to at least carve out a little bit of time for yourself is so important. And it doesn't have to be a week away or anything like that, but even just an hour a day where everything else is taken care of and you can just have time on your own. Maybe it's a nap, maybe it's reading a book, having a bath, going for a nature walk, like whatever that looks like for that individual, just having what I like to call is like protected time that is for you, can be so important, as well as potentially working with a therapist. That's a big part of, I recommend psychotherapy or social work, one-on-one work to many, pretty much everyone who comes in struggling with mood. That's one of the referrals that I absolutely recommends. Again, so you can have that time to just on your own express everything you're feeling and going through and develop the new coping mechanisms that you may need. And then sort of like on that same vein, I would say like any body work that people can access is always nice to do. So whether that's a massage, osteopathy. One of the services I offer is acupuncture, so that can be really nice for just supporting the nervous system. All of those things can be helpful. And with the baby as well, like we talked about, kind of looping back to the very beginning of the session, is getting outside. Like try to get outside, even if it's just for a little while, every single day, like regardless of the weather. Just getting a little bit of natural light on your face and breathing fresh air, even if it's just a walk around the block, can be really helpful.
Yeah, it's amazing what getting outside can do. It just changes everything, at least
It really,
temporarily.
it really does. Yes. And babies tend to love being outside too.
Yeah, it's still one of my key parenting strategies, right? From when my kids were babies, was just get outside for my mental health, but also for their mood and their behavior. Everybody's suddenly happier and we get along better because
Yeah.
fresh air just does something to you.
A little system reset. Yeah. I mean, and there's possibly a lot of your listeners have heard of like forest bathing. So this is actually something that is, believe it or not, well researched. And I'm not saying, you have to get to a forest because that's not always realistic, but there is actual scientific evidence to show that like just being amongst trees, being amongst nature, um, just being in it is so calming for our nervous system.
Yeah, it really is huge. We are part of nature, and sometimes we can forget that.
Absolutely.
So, can you tell us a bit about the acupuncture that you do? Like, how do you do that with new moms? And do you do that with babies as well?
Mm, I've never done acupuncture on a baby. I don't know. I don't think you could do it on a baby because they wiggle around too much. But on a mom, yeah. So it is one of the things where, once you have the needles in, you really can't move. So you would need someone to, be watching the baby for the period of that appointment. But essentially, acupuncture is part of traditional Chinese medicine, and it's part of our curriculum at Naturopathic Medical School. And within the body, we have 12 different meridian or energy channels. And based on sort of the symptom picture that someone is presenting with, we choose points, on different areas of the body that will help to support that person. So there's a lot of different points that kind of help to just calm the mind and relax. So we will choose a set of points for the individual. And then once the needles are in, you basically just get to lie there, relax. We put on some light music. Sometimes people would like a meditation, so we'll listen to that. And that's basically it. So it's just kind of a nice, relaxing time where you can just be alone, have quiet your thoughts and experience the process.
That sounds lovely. And it is really that forced time to just, like you say, do a meditation or just be still and not have to do anything else.
Yeah, exactly. It's a little, you get to fill up the battery a little bit so that you can keep going afterwards.
It's really important to have that dedicated time, isn't it? Because I think back to when I had my little ones and I didn't really have much support around. So I would try and get things done when they were napping and I would try to be rushed because I didn't know how long I had. And I still catch myself putting cutlery away really quickly. And I don't, you have to train yourself to slow down and take some time. So having that dedicated time where your baby is with somebody else, is being cared for, allows you to really let your body drop into being in a more relaxed state.
Yes, absolutely. It's so true. That just sort of made me think about other things that can be nice, which is, if the baby's napping, just doing some really gentle stretching, like things, even just one movement I love is um, lying on your back and then having kind of your bum up to the wall and putting your legs up the wall and just staying in that position, that supported legs up the wall position can just be really nice. Or even just, Shavasana, just lying on the floor, maybe like gently, gently rotating your spine around, like your hips back and forth. Slow movements can be really nourishing.
Yeah, legs up the wall is one of my favorite ways to end the day. It's so
Yeah,
good.
it is. It's so supportive.
And what would you tell moms who are listening who are still feeling really stuck in that overwhelm and anxiety and just don't know where to begin? Where do you recommend they start?
That's a good question. Well, I think the first thing is to remind yourself, like repeatedly remind yourself that this is a phase and it will pass. So that can, in and of itself, be comforting. I'm not saying that's going to relieve all the sense of overwhelm that you're feeling in that moment, but just remembering like it won't always be this hard. I promise it won't. It's going to change and it's going to get easier and harder in different ways as time goes on. But the intensity of it in those early days, is temporary. And then probably if you haven't, step one would be just telling someone how you're feeling. Like don't hold it all in. If you feel comfortable talking about it with your partner, do that. If that doesn't feel great or safe for you, call a friend, family member, like whoever it may be. Don't struggle in silence. Like reach out for support and have your support system. If you're not sure like where to even begin, just ask someone else. Be like, I'm really struggling, I'm overwhelmed, I don't know what to do, can you help me figure it out? Just don't feel like you have to do it all on your own.
Yeah, because it can be hard to take on one more task, like you're saying before, if we're, feeling stressed, having that other thing on your to-do list to try to de-stress. Same
Yeah.
thing here. Like you can get that support.
Yeah, everything, it's so funny. Even I remember the very first time I had to give my daughter a bath, I felt so overwhelmed. I was like, she's so tiny. I don't know like how hot the water should be. I don't know like how big or small the tub should be. It was just like, so I called my mom. I was like, you need to help me. You need to help me figure this out. These small things can feel so overwhelming when you're doing it for the very first time.
Yeah, absolutely. And if you could go back and tell yourself in maybe leading up to giving birth or in that first week, what is something that you would tell yourself that you think would be, I don't know, helpful or good to hear at that moment now that you have all this experience?
Yeah, that's a really good question. Um, I think I would tell myself like, don't worry, this is going to get better. Um, and also remind myself about the importance of self-compassion. I talk to a lot of people about self-compassion, and I think it's an easy thing to kind of brush off. Like I feel like people are often like, yeah, yeah, self-compassion. I should be nice to myself. I know, blah, blah, blah. But it's actually so incredibly important to have the skills to be able to offer compassion to yourself the way that you would to a loved one. And it's not easy to do. So I think the more you can improve in your self-compassion skills, the better. And there is a whole website, self-compassion, oh, is it .ca or .com? Kristen Neff, she's done a ton of research in that world. So people can read up on it, and she has self-compassion led meditations and that kind of thing. So incorporating self-compassion as early as possible is highly recommended.
Yeah, I think as women, or maybe just people in general, we should be practicing this from when we were children.
Yeah, it's when you were born, really.
Yeah. One
So
of my favorite ways to practice self-compassion is just to put my hand like on my chest, on my heart, and just that touch makes such a difference. It helps to like slow my nervous system, connect me to the present, and
yeah.
just I don't know, it's just such a compassionate thing to do. And it's so easy. You can do it in any moment. Do you have any recommendations or go-tos that you use for yourself for self-compassion?
I think something that I've started doing a lot more in the last few years that has been quite helpful is actually like actually like talking quietly to myself and kind of rooting myself on in the way that I would do, say, for my children or someone else. Like if I'm engaging in something that I'm really nervous about, or I'm feeling um, not a lot of confidence in a certain realm or whatever, just saying, Madeline, you got this. You can do this. I believe in you. All of the same things that basically I would say to my children. I actually literally say it to myself, and it helps, just giving yourself that love and encouragement. We're often our own, like our biggest critic. And I mean, I still am. We all are. It's extremely hard to completely undo that. But like anything, any new skill, like if you think of it as a muscle that needs to be strengthened, the more you do it, the more you really start to believe it, and the more it works.
And the more automatic it becomes too, right? Like I imagine for you now, you start pepping yourself up more
Yeah.
quickly than a few years ago.
Oh, yeah, exactly. Yeah, I never really used to do that at all. I think I would just keep all the fear feelings inside and try to, mask whatever I was feeling and just suffer through and then feel exhausted afterwards. But now I approach it totally differently.
Yeah, it is such an important skill. And I think you're right. Like when you started talking about it, that it's something that people are like, oh yeah, yeah, self-compassion, that's lovely. But there
Yeah.
is so much research on it to say
Yes.
that it is very, very impactful.
Yeah, absolutely. Changing that inner voice can make a big difference.
Yeah.
Mhm.
Was there anything that you wanted to talk about here or any question that you wanted me to ask about
Mhm.
postpartum anxiety that we didn't cover?
Hmm. I don't think so. I think we did a great job of covering a lot of the big things. Um, Yeah, nothing's really. I'm just looking at my notes to see if there's anything that I have support, underline, underline, underline. So remembering to get lots of support and really just taking it like one day at a time. Don't think too far ahead of the future. And I think, oh, maybe in the realm of support, like one little thing that we didn't talk about that I think a lot of people do, but is getting out to some of those kind of mom groups where you're meeting with other parents who have babies around the same age as you. That can also be incredibly important, just to normalize a lot of the experiences that you're going through, like, oh, my baby did that. And yeah, that was really hard for me too. And that's so helpful to know that you are all experiencing that same thing. Or even just knowing that there's a bunch of people who are also up at 3 a.m., struggling through, feeling exhausted, to feel a little bit less alone. I think those social groups can be really important.
Yeah, they are
Mhm.
one of the most important things, I think.
Yeah, absolutely.
Yeah. Well, thank you so much for coming on here and for sharing so much knowledge with us and for the work that you're doing supporting women and moms as a naturopathic doctor. I appreciate it so much.
Yeah, thank you so much. It was really, really nice to chat with you today.